Top 7 Essential Vitamins for Heart Health in Seniors. Reducing Stroke Risk. A healthy heart is the foundation for maintaining an active, independent, and high-quality life in older adults. However, over time, due to physiological changes and the impact of modern living environments, the cardiovascular system faces major challenges such as hypertension, atherosclerosis, heart failure, and stroke. Modern scientific research shows that in addition to a healthy lifestyle, ensuring adequate intake of certain essential vitamins plays a crucial role in protecting the heart from silent damage. This article will guide you through a detailed exploration of the 7 most important vitamins for strengthening and maintaining cardiovascular health in seniors. Each vitamin operates through a distinct mechanism but shares the same ultimate goal: keeping the heart strong, the rhythm steady, and life full of vitality. Vitamin D, the golden light for heart health. Vitamin D is often called the sunshine vitamin because the body can synthesize it through the skin when exposed to sunlight. However, in older adults, the ability to naturally produce vitamin D decreases significantly due to aging skin and environmental factors. A deficiency in vitamin D has been directly linked to an increased risk of cardiovascular conditions such as hypertension, heart failure, and atherosclerosis. Vitamin D plays a crucial role in regulating the renin-angiotensin system, a complex biological mechanism that controls blood pressure and fluid balance in the body. When vitamin D levels are insufficient, this system becomes overactive, leading to vasoconstriction and fluid retention, which in turn cause elevated blood pressure. Over time, high blood pressure damages blood vessel walls, forcing the heart to work harder to pump blood, resulting in left ventricular hypertrophy and eventually leading to heart failure. Moreover, vitamin D has strong anti-inflammatory properties. It helps inhibit pro-inflammatory cytokines like interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha, which are major contributors to chronic vascular inflammation, a key factor in the development of atherosclerotic plaques. Additionally, vitamin D is involved in maintaining endothelial function, the health of the inner lining of blood vessels, which is vital for preserving vascular elasticity and normal dilation, both critical in preventing heart attacks and strokes. A study published in Circulation found that individuals with low blood vitamin D levels had a 60% higher risk of coronary artery disease compared to those with sufficient levels. Another U.S. study indicated that maintaining serum vitamin D levels between 30 to 50 nanograms per milliliter significantly reduced hospitalization rates due to cardiovascular diseases in older adults. Vitamin D also supports blood sugar regulation by improving insulin sensitivity, thereby indirectly reducing the risk of type 2 diabetes, a major risk factor for heart disease. In older adults who are obese or have metabolic syndrome, maintaining optimal vitamin D levels can help improve systemic inflammation and metabolic disorders. However, it is important to supplement vitamin D wisely. Excessive vitamin D intake can lead to hypercalcemia, causing calcium deposits in the arterial walls, kidneys, and other soft tissues, resulting in dangerous complications. Therefore, supplementation should be based on regular blood tests and medical guidance, especially for seniors with underlying conditions such as kidney disease or coronary artery disease. The best natural sources of vitamin D include sunlight exposure, about 15 to 20 minutes daily during early morning or late afternoon, fatty fish such as salmon, mackerel, and sardines, egg yolks, fortified milk, and cereals. In many cases, doctors may recommend vitamin D3 supplements to achieve desired blood serum levels, particularly during winter or in regions with limited sunlight. In summary, vitamin D is an essential factor in helping seniors maintain a healthy and resilient heart against the challenges of aging. Investing in proper vitamin D management today will lay the foundation for a strong cardiovascular system and a reduced risk of serious diseases in the future. Vitamin C, the antioxidant fortress protecting the elderly heart. Vitamin C has long been recognized as one of the most essential nutrients for overall health. However, few realize its tremendous role in protecting the cardiovascular system, especially in seniors, the most vulnerable group to dangerous conditions like hypertension, atherosclerosis, and heart failure. As a powerful antioxidant, vitamin C plays a central role in shielding blood vessel walls from damage, improving endothelial function, and slowing the progression of cardiovascular disease over time. Vitamin C's mechanisms of action on heart health are diverse. Firstly, it acts as a scavenger of free radicals, unstable molecules that can damage cells and DNA. Free radicals are constantly generated in the body, but in older adults, natural antioxidant defenses decline, leading to increased accumulation of free radicals and accelerated vascular endothelial damage. When the endothelium is compromised, it loses its ability to regulate blood pressure and becomes more susceptible to infiltration by low-density lipoprotein, LDL, cholesterol, paving the way for plaque formation. Vitamin C strongly supports the protection of the endothelium. By enhancing the synthesis of nitric oxide, a molecule that naturally dilates blood vessels, vitamin C helps maintain vascular flexibility and elasticity. When arteries can dilate properly, blood pressure stabilizes, the heart works more efficiently, and the risk of heart failure or stroke decreases significantly. Additionally, vitamin C is involved in collagen synthesis, the main structural protein in blood vessel walls. Without sufficient vitamin C, collagen production declines, making blood vessels more prone to damage, rupture, or bleeding. This explains why severe vitamin C deficiency, scurvy, causes symptoms such as subcutaneous bleeding, weakened vessels, and heart failure. Even at milder levels, adequate vitamin C intake helps maintain strong vessel walls, better withstanding mechanical stress from circulating blood. Another crucial aspect of vitamin C is its ability to lower LDL cholesterol and raise HDL, good cholesterol. Studies have shown that maintaining stable serum vitamin C levels can reduce LDL cholesterol by about 7 to 10%, a modest yet meaningful reduction in long-term coronary artery disease prevention. Vitamin C may also lower blood triglyceride levels, another risk factor for heart disease. Clinical evidence indicates that people who consume more vitamin C-rich foods, such as citrus fruits, strawberries, kiwis, and red bell peppers, have significantly lower rates of cardiovascular disease compared to those with low vitamin C intake. A study published in the American Journal of Clinical Nutrition found that higher serum vitamin C levels were associated with a 25% lower risk of death from heart disease over a 10-year follow-up period. For older adults in the US and other Western countries, where diets often lack sufficient fresh fruits and vegetables, increasing vitamin C intake is especially crucial. A healthy diet should include at least 5 to 7 servings of fruits and vegetables daily, prioritizing vitamin C-rich options like oranges, grapefruits, kiwis, strawberries, and leafy greens such as broccoli and spinach. When necessary, vitamin C supplements can be used, but dosage should be determined with medical guidance to avoid excessive intake, which can lead to kidney stones or digestive issues. Since vitamin C is water-soluble, the body does not store it long-term. Therefore, regular daily intake is needed to maintain its protective effects. In healthy older adults, the recommended daily intake is about 75 to 90 milligrams, but for those at high cardiovascular risk, doctors may recommend higher doses, up to 500 to 1,000 milligrams daily, depending on individual needs. In summary, vitamin C is an indispensable ally for the aging heart. By protecting blood vessels, reducing inflammation, combating oxidative stress, and improving lipid profiles, vitamin C helps slow cardiovascular aging, offering seniors a greater chance of living longer and healthier lives. Investing in vitamin C through a rich diet and healthy lifestyle is one of the simplest, yet most effective secrets to nurturing a resilient heart through the years. Vitamin E, the antioxidant shield protecting the elderly heart. Vitamin E has long been recognized as one of nature's most powerful antioxidants. However, when it comes to cardiovascular health, especially in seniors, its role extends far beyond what we typically imagine. Vitamin E not only protects cells from free radical damage, but also actively prevents the fundamental pathological processes leading to heart attacks, strokes, and heart failure. The first key aspect of vitamin E is its ability to prevent the oxidation of LDL cholesterol, commonly known as bad cholesterol. In the body, LDL carries fats to tissues, but when oxidized by free radicals, it becomes dangerous. Oxidized LDL easily penetrates arterial walls, triggering inflammation and plaque formation, the core cause of most cardiovascular diseases. With its potent antioxidant properties, vitamin E acts as a biological shield, preventing LDL from oxidizing and breaking a critical link in the chain of atherosclerosis development. In addition, vitamin E positively impacts systemic inflammation, an often silent but major risk factor in cardiovascular disease. Studies show that chronic low-grade inflammation in blood vessels can damage the endothelium, disrupt vascular function, and accelerate coronary artery disease progression. Vitamin E helps reduce the production of pro-inflammatory cytokines such as interleukin-1 beta, IL-1 beta, interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha, while enhancing the production of anti-inflammatory molecules like prostacyclin, which aids in vasodilation and prevents platelet aggregation. Beyond its antioxidant and anti-inflammatory roles, vitamin E also improves blood circulation by reducing platelet aggregation, a major risk factor for blood clot formation. By keeping platelets less sticky, vitamin E indirectly reduces the risk of vascular blockages, thus preventing serious events like strokes and heart attacks in older adults. Several clinical studies have reinforced vitamin E's role in cardiovascular protection. For example, the Health Professionals Follow-up Study in the U.S., tracking over 39,000 middle-aged and older men, found that those with higher dietary vitamin E intake had a significantly lower risk of coronary artery disease compared to those with the lowest intake. Similarly, the Nurses' Health Study, involving over 87,000 female nurses, also reported clear cardiovascular benefits from adequate vitamin E consumption. However, it's important to note that these positive results primarily stemmed from natural dietary sources of vitamin E rather than high-dose synthetic supplements. Some studies using high doses of synthetic vitamin E supplements did not show clear heart protection benefits, and in some cases even suggested increased risks of brain hemorrhage or mild heart failure in individuals with pre-existing conditions. Therefore, experts recommend that seniors prioritize obtaining vitamin E through natural food sources rather than relying heavily on supplements. Ideal vitamin E-rich foods include almonds, sunflower seeds, hazelnuts, extra virgin olive oil, and dark leafy greens like spinach and kale. A diverse diet rich in nuts and vegetables not only supplies natural vitamin E, but also offers a wealth of other phytonutrients that support overall heart health. The recommended daily intake for vitamin E in adults is about 15 milligrams of alpha-tocopherol. For seniors, maintaining this intake consistently through their daily diet helps strengthen vascular resilience, slow down vascular aging, and lower the risk of cardiovascular diseases. In summary, vitamin E is not just an ordinary antioxidant. For the aging heart, it serves as a silent gatekeeper, protecting each vessel cell from dangerous damage, preserving vascular flexibility and strength, and ultimately extending lifespan and improving quality of life. Vitamin K2, the guardian against arterial calcification in seniors. Vitamin K2 is one of the lesser-known nutrients in daily life, yet in modern medicine, it is regarded as an essential factor for cardiovascular health, especially in older adults. Unlike vitamin K1, which primarily aids blood clotting, vitamin K2 plays a fundamental role in regulating calcium transport, ensuring that this mineral reaches the right places, bones, and does not accumulate in the wrong ones, arterial walls. From the age of 60 onwards, the body increasingly deposits calcium where it shouldn't, particularly in blood vessel walls. Arterial calcification, where arteries become stiff and thick due to calcium buildup, is a leading cause of atherosclerosis, reduced blood flow, high blood pressure, and ultimately heart attacks or strokes. Vitamin K2 helps prevent this dangerous process by activating specific proteins, most notably matrix GLA protein, MGP, which captures calcium and prevents it from adhering to the vessel walls. A well-known study published in the Journal of Nutrition followed over 4,800 adults for 7 to 10 years. Results showed that individuals with higher vitamin K2 intake had up to a 50% lower risk of death from heart disease compared to those with the lowest intake. Additionally, calcium accumulation in the aorta, a key early indicator of atherosclerosis, was significantly lower in the group with adequate vitamin 2 intake. Beyond protecting vessel walls, vitamin 2 helps maintain the elasticity and flexibility of the circulatory system. Healthy arteries must expand and contract smoothly to regulate blood pressure according to the body's circulation needs. When arteries calcify, their ability to expand declines, forcing the heart to work harder to pump blood, which over time can lead to heart failure. By ensuring calcium is properly directed into bones and preserving vascular elasticity, vitamin K2 becomes a silent protector of long-term cardiovascular health. Interestingly, the body does not produce vitamin K2 in sufficient quantities naturally, and it is not abundant in a typical Western diet. The richest food sources of vitamin K2 include natto, a fermented soybean dish popular in Japan, animal liver, free-range egg yolks, aged cheeses like Gouda and Brie, and some other fermented foods. Unfortunately, natto, despite its high vitamin K2 content, is not widely accepted in American and European diets, making vitamin K2 deficiency relatively common among seniors. In recent years, healthcare experts have recommended vitamin K2 supplementation, especially for older adults at high risk of arterial calcification or those taking calcium supplements. Supplementing calcium without adequate vitamin K2 increases the risk of calcium depositing in blood vessels instead of bones, which can worsen cardiovascular conditions. The recommended intake for vitamin K2 in adults typically ranges from 90 to 180 milligrams per day, depending on overall health status and physician guidance. Some supplements combining vitamin K2 with vitamin D3 have also been shown to optimize calcium metabolism and provide simultaneous protection for both bones and blood vessels. However, it's important to note that vitamin K2 can interfere with blood-thinning medications like warfarin. Therefore, any supplementation plan should be discussed with a physician first, especially for seniors on anticoagulant therapy or with complex cardiovascular conditions. In summary, vitamin K2 plays a vital role in protecting cardiovascular health in seniors by preventing arterial calcification, maintaining vessel elasticity, and optimizing bone health. Maintaining proper vitamin K2 levels through diet or supplementation when necessary may be one of the most effective strategies to extend lifespan, reduce cardiovascular risks, and help older adults maintain a vibrant and high-quality life in their later years. Vitamin B6, the savior for controlling homocysteine and protecting heart health. Vitamin B6, also known as pyridoxine, is a silent yet vital nutrient for heart protection, especially in seniors. Unlike other vitamins that mainly act through antioxidant mechanisms, vitamin B6 directly influences metabolic processes in the body, particularly by controlling blood homocysteine levels, a proven risk factor closely linked to cardiovascular disease, stroke, and heart failure. Homocysteine is an amino acid naturally produced during protein metabolism. Under normal conditions, it is rapidly converted into harmless substances with the help of B vitamins, especially B6, B12, and folate. However, when the body lacks vitamin B6, this conversion is impaired, leading to the accumulation of homocysteine in the blood. Elevated homocysteine levels directly damage the vascular endothelium, promote inflammation, and increase the risk of blood clots, resulting in heart attacks or strokes. Research has shown that high homocysteine levels, independent of traditional risk factors like cholesterol or blood pressure, can double the risk of coronary artery disease. Especially in seniors, whose metabolic function declines over time, vitamin B6 deficiency becomes more common, making homocysteine control even more critical for preventing cardiovascular disease. Beyond homocysteine regulation, vitamin B6 is involved in over 100 enzymatic reactions in the body, including the synthesis of important neurotransmitters like serotonin, dopamine, and GABA. These neurotransmitters affect mood and sleep, and also influence the autonomic nervous system, which controls heart rate and blood pressure. A healthy autonomic nervous system helps stabilize heart rhythm and blood pressure, offering long-term cardiovascular protection. A large study published in the American Journal of Clinical Nutrition followed over 5,000 adults for 10 years and found that those with the highest serum vitamin B6 levels had up to a 30% lower risk of heart disease compared to those with the lowest levels. Another study in Europe showed that supplementing vitamin B6, along with folate and B12, significantly reduced homocysteine levels, thereby lowering cardiovascular mortality in individuals over 60 years old. Vitamin B6-rich foods are abundant and easily accessible, especially in Western diets. Common sources include salmon, tuna, chicken breast, animal liver, bananas, potatoes, and whole grains. However, improper food preparation and storage, such as overcooking, can significantly reduce the natural vitamin B6 content. Older adults generally require more vitamin B6 than younger individuals due to reduced gastrointestinal absorption and increased renal excretion. It is recommended that adults over 50 years consume about 1.5 to 1.7 milligrams of vitamin B6 daily. In certain cases, such as for individuals with diabetes, chronic kidney disease, or those taking medications that deplete vitamin B6, e.g., isoniazid, hydralazine, doctors may prescribe higher doses. Although vitamin B6 is relatively safe, prolonged intake of very high doses, over 100 milligrams per day, can cause peripheral neuropathy, manifesting as numbness and muscle weakness. Therefore, supplementation should always follow recommended dosages and be supervised by a healthcare professional, especially in seniors with complex underlying health conditions. In summary, vitamin B6 is a powerful ally in protecting cardiovascular health in seniors. By controlling homocysteine levels, supporting vascular endothelial function, and stabilizing the autonomic nervous system, vitamin B6 plays a crucial role in reducing heart disease risk, improving quality of life, and extending longevity. A well-balanced diet, rich in natural vitamin B6 sources, combined with a healthy lifestyle, is key to maintaining a strong heart in the later years of life. Vitamin B12, a powerful ally with vitamin B6 in protecting blood vessels and heart health. Vitamin B12, also known as cobalamin, is an essential vitamin for the body, particularly in protecting the nervous system, producing blood cells, and maintaining cardiovascular health. For seniors, vitamin B12 plays an even more prominent role, as aging diminishes the body's ability to absorb this vitamin, increasing the risk of deficiency, a silent yet dangerous contributor to various serious health disorders, including heart disease. Like vitamin B6 and folate, vitamin B12 is involved in the metabolism of homocysteine, an intermediate amino acid in methionine metabolism. When the body lacks B12, homocysteine accumulates in the blood, damaging the vascular endothelium, promoting chronic inflammation, and increasing the risk of plaque formation. Numerous studies have shown that elevated homocysteine levels are an independent risk factor for coronary artery disease, stroke, and cerebrovascular events. For older adults, managing homocysteine by maintaining adequate vitamin B12 levels is a simple yet highly effective strategy for preventing the progression of cardiovascular disease. Beyond controlling homocysteine, vitamin B12 supports the production of healthy red blood cells. Adequate and functional red blood cells ensure continuous oxygen delivery to tissues, including the heart muscle, the body's central pump. Prolonged vitamin B12 deficiency can lead to macrocytic anemia, reducing oxygen carrying capacity and forcing the heart to work harder to compensate for oxygen deprivation, eventually resulting in heart failure if not promptly addressed. A noteworthy point is that vitamin B12 deficiency is relatively common among seniors. This is not only due to poor dietary intake, but also because of reduced stomach acid secretion and intrinsic factor production, both necessary for absorbing vitamin B12 from food. Studies show that 10 to 15% of Americans over age 60 experience mild to moderate vitamin B12 deficiency, many without timely diagnosis. The Framingham Offspring study found that individuals with low blood vitamin B12 levels had a significantly higher risk of cardiovascular events, such as heart attacks and strokes. Clinical trials have also demonstrated that vitamin B12 supplementation, especially when combined with B6 and folate, effectively reduces plasma homocysteine levels, lowering the incidence and mortality of cardiovascular disease in older adults. Rich dietary sources of vitamin B12 are primarily animal-based, including red meat, liver, salmon, tuna eggs, and dairy products. However, strict vegetarians and older adults with absorption issues often require vitamin B12 supplements, either orally or via subcutaneous injection, as prescribed by a physician. This becomes even more critical for seniors who have undergone gastric surgery, bowel resection, or suffer from conditions like autoimmune gastritis. Supplementation dosage depends on the severity of deficiency, but for generally healthy older adults, the recommended daily intake is about 2.4 micrograms. However, due to the significantly decreased absorption with age, many experts advise seniors to use higher dose supplements or more bioavailable forms like methylcobalamin to ensure effectiveness. Although vitamin B12 is water-soluble and very safe, Excessive self-supplementation over a long period without medical supervision is discouraged, as it may interfere with lab test results or mask other underlying conditions. In summary, vitamin B12 is a silent yet immensely powerful ally in protecting cardiovascular health in seniors. By controlling homocysteine levels, maintaining optimal red blood cell function, and supporting a stable nervous system, vitamin B12 not only helps extend lifespan, but also enhances quality of life. Ensuring sufficient vitamin B12 intake, whether through a balanced diet or appropriate supplementation, is one of the most practical steps older adults can take to keep their hearts strong through the years. Folate, vitamin B9, the homocysteine balancer, and a golden key to heart health in seniors. Folate, also known as vitamin B9, is an essential nutrient playing a crucial role in many important biological processes. For cardiovascular health, especially in seniors, folate acts as a silent guardian, directly involved in regulating blood homocysteine levels, a hidden yet powerful risk factor for blood vessel damage and the development of heart disease. Homocysteine, an intermediate amino acid in methionine metabolism, if elevated in the bloodstream, significantly increases the risk of atherosclerosis, heart attacks, and strokes. Alongside vitamin B6 and vitamin B12, folate is central to converting homocysteine into methionine, a harmless amino acid. Folate deficiency impairs this conversion, leading to elevated homocysteine levels that place extra strain on the cardiovascular system and accelerate endothelial inflammation. Clinical studies have shown that individuals with low folate levels have a markedly higher risk of coronary artery disease compared to those with sufficient folate. A large-scale study published in the American Journal of Clinical Nutrition found that folate supplementation could lower serum homocysteine levels by up to 25%, thereby reducing cardiovascular disease risk by 10 to 15% in adults, particularly seniors. Beyond influencing homocysteine, folate also helps protect endothelial function, the thin, delicate cell layer lining blood vessels. A healthy endothelium allows blood vessels to dilate flexibly, prevents clot formation, and maintains stable blood pressure. When the endothelium is damaged by high homocysteine levels or chronic inflammation, atherosclerosis progresses rapidly, leading to serious cardiovascular events. Additionally, folate is involved in DNA synthesis and cell regeneration, helping rejuvenate blood vessel walls and preventing premature vascular aging, an important factor in maintaining a resilient and healthy circulatory system as people age. One important distinction to note is that natural folate from foods differs from folic acid, the synthetic form found in supplements and fortified foods. The body absorbs natural folate from leafy greens, legumes, avocados, and citrus fruits more efficiently and with a lower risk of excess-related side effects compared to high-dose synthetic folic acid. Thus, for seniors, prioritizing natural folate sources is the smarter and safer choice. However, many older adults in the U.S. and Western countries struggle to meet folate needs due to diets low in fresh vegetables, reliance on processed foods, or impaired gastrointestinal absorption. Chronic conditions like diabetes, kidney disease, or inflammatory bowel disease further diminish folate absorption and utilization, increasing deficiency risk. The recommended daily folate intake for adults is around 400 micrograms, but for seniors or those at high cardiovascular risk, doctors may suggest higher amounts depending on individual health status. Supplementation should be approached carefully, as excessive long-term folic acid intake may mask vitamin B12 deficiency, potentially leading to irreversible nerve damage. Natural folate-rich foods that can easily be included in daily meals include spinach, kale, broccoli, lentils, green peas, avocados, oranges, and strawberries. A folate-rich diet not only supports heart health, but also enhances overall wellness, boosts immunity, and helps maintain mental clarity in seniors. In summary, folate is a golden key in the strategy for cardiovascular protection in seniors. By maintaining stable homocysteine levels, supporting endothelial function, aiding DNA synthesis, and slowing vascular aging, folate contributes to longer lifespan and better quality of life. A diet rich in natural folate, combined with a healthy lifestyle and regular health screenings, empowers seniors to enter the golden years with a strong and vibrant heart. A healthy heart is not only a symbol of vitality, but also the foundation of longevity and happiness in older adults. Through detailed analysis, we can see that each vitamin from D, C, E to the B group and K2 plays an essential role in protecting blood vessels, regulating blood pressure, controlling inflammation, preventing arterial calcification, and maintaining a healthy circulatory system. Supplementing these vitamins through a rich, balanced diet, and when necessary, appropriate supplementation under the guidance of healthcare professionals is the key for seniors to live longer, healthier, and more fulfilling lives. Remember, taking care of your heart today is not just for your health tomorrow, but for the meaningful years ahead with family, friends, and dreams yet to be fulfilled. Investing in heart health today is the most precious gift you can give to yourself and to those you love.